Today I want to talk to you about what happens in the brain after having hearing loss for some time and why hearing aids alone may not work as well as they should. Welcome to Earman Dan. If you're new here, my name is Daniel and a very warm welcome. I'm a hearing care professional and the owner of Ear Studio in Castle Hill in Sydney. But more importantly, I spend my days helping people, not just to hear better, but actually to understand better and leave behind the challenges of hearing loss. And in this channel, I break down how hearing really works, how the hearing care landscape looks in Australia, and what you can do to get the best possible outcome. Now, I invite you to follow along in this journey. A really important aspect of hearing treatment, any hearing treatment in that case, is what we call auditory processing. You may remember, if you watched some of my previous videos, that understanding speech is actually a brain process. It takes into account the things that the ears hear, what the eyes see, and what the context of the situation or the conversation is about. It's quite a sophisticated process, actually. One part of that is what we call auditory processing. And that is essentially the brain correctly identifying the signals that the ears provide to the brain. And that's a skill like any other skill, and it's normally learned early on in life. Actually, it's not one skill, it's many skills. Differentiating intensity and frequency in sounds, temporal processing, that is time differences in sound signals, rapid speech, speech and quiet, speech and noise, and spatial processing. So that's the location of sound. The auditory memory is also a part of that. So it's a lot of skills that must be learned. And it takes all those skills to understand speech and process sounds well. It starts around age 2. And a big chunk of learning that skill is actually done between age 2 and 5. From around 5 to 15, then that continues. And from around mid-teenager age, it's considered complete to the level of an adult. And as long as that person is hearing these skills well, their skills are being used and maintained. But you know the saying, use it or lose it. And that's true with these skills as it is with any other. You stop working or doing certain things and a few years later, it's much harder to pick up. Take golf. You got to keep at it. If you stop playing for some years and you want to pick it up again, it may take some lessons to get back into it. Any skill takes practice. And I've experienced that myself actually making these videos. It's actually quite hard, and I'm certainly still not fantastic at it and still improving, hopefully at least. But I can't believe how much time and frustration it was in the beginning to try and speak in front of a camera. I've never been a really shy person or anything like that, and I've got no trouble talking, but it still required a lot of practice and feedback and advice from others that have been doing it for a long time. And obviously, as you can see, it's still an ongoing process. A skill that I need to keep developing if I want to deliver a message of better hearing to more people. And the same with auditory processing. Let's go back to golf. When you stop playing golf, say due to an injury, you suffer from what some people consider a severe condition called golf deprivation. It is the starving of the human body of the experience to experience the pleasures and the horrors of playing golf. As a result, you lose your skills, or at least they get weaker. And when you develop hearing loss, you experience what we call auditory deprivation, a decline in auditory processing or speech recognition ability caused by the prolonged reduction of auditory input to the central auditory system. In other words, the brain is just not receiving enough sound from the ears to maintain these skills. So the processing can deteriorate or disorganize. And the result, it's much poorer speech understanding, especially in the presence of background noise. And I'm sure many of you have experienced that. Now, this is often the first symptom. You know, the issue with auditory deprivation is that unlike golf deprivation, it doesn't hurt and you don't feel it. But you know, once your family members or your mates have recognized that you're just not hearing as well as you should, they start telling you that. And at that stage, your hearing loss is likely already 3 to 7 years old. That is before you realize it yourself. Industry research has actually shown that it takes another few years before you take action. In total, that time is currently estimated to be sometime between 7 and 10 years of hearing loss before you visit an audiologist to treat the hearing loss. Now, that's a long time not playing golf, isn't it? Imagine you stop playing for that long, maybe because like a hip issue or a knee issue. And then you finally get that knee or that hip replaced and you pick golf up again. So you paid a lot of money for new clubs and a new hip or knee replacement and for a membership. But it's been 10 years. How well are you doing? Yeah, that's right. It's frustrating. And everyone expects that after 10 years of not playing and a knee replacement, going back to golf, you need physiotherapy, you need time to heal, you need rehabilitation, you need golf lessons, and you need lots of time to practice. But with hearing aids, it's all different. You haven't heard properly for 7 to 10 years, but yet you expect, because you've paid a lot of money for the hearing aids, that the hearing aids restore 100% of your hearing instantly. But that's not the case, and it can't. Like a knee replacement cannot make you run a marathon instantly. The brain actually needs to do all the work in the hearing process, or in the understanding process, I should say. And for that to happen, the brain needs to have a few things. It, number one, needs access to sounds again. It needs to hear the sounds that it hasn't heard for so long. It needs to hear them again, and that means getting hearing devices. But it also means it needs lessons, like golf lessons, right? It needs guided auditory training, and it needs time to practice. It doesn't go overnight. And then, over time, with the practice, with the lesson, and with the time to wear the hearing devices, the brain will get better and better, and you notice that you can hear much better in background noise again. I make a point of that because it's really, really important to have realistic expectations of what the process looks like and also what is involved. If you don't do the work of auditory rehabilitation, you can't really expect fantastic outcomes. You really need to partner with your hearing care professional if you want to get that all right. I know of a client not too long ago. They've known that they've had hearing loss for some decades. I think it's been 25, 30 years or so. But they managed to put up with it, and they kind of got by with lots of compensatory strategies and so on, and even avoiding certain situations because they knew they couldn't hear. But then at some point, the family pressure kind of got higher and higher, and they themselves realized it's getting harder and harder, and they can no longer put up with it. So finally, they got hearing aids. And these hearing aids, they should have had like 20 years ago. But then they were bitterly disappointed after 4 days. It cost a lot of money, and it just didn't fulfill their expectations. Not because the hearing aid was bad or anything, but number one, the expectations were off a little. As I mentioned previously, they expected that hearing aid just makes them hear and understand everything. Number two, they haven't had enough time or training yet to experience the improvement. Then we worked with this client for quite some weeks. We did some auditory processing training, and now they're doing so much better and cannot even imagine living without the hearing aids. But in the first week, they were ready to return the devices and write it off as like, hearing aids just don't work for me. And that risk is real, that then another few years go past before they give it another go. And that is really tricky, because the more years go past, the harder it gets for the brain to relearn these auditory skills. The good news is that with the right hearing aids and with the right fitting and with the right process, you can significantly improve your hearing performance. In Germany, as you know where I'm from, we've done auditory training, I would say, for around 25 to 30 years. I've been doing audiology now for 24 years nearly, and the systems were well in place when I started. This type of training usually contains certain listening exercises, and previously when I first started, they were recorded on cassette tapes, later on CDs, and now today it's all on apps, which obviously makes the whole thing a lot easier. Now there's an app-based program that was recently released in Australia, the first of its kind here in Australia, which is called Lace AI Pro. It's based on an app that you can download on your phone, and with a once-off payment, you get lifelong access to auditory training. The biggest results are achieved after around 4 to 6 weeks with around 15 to 20 minutes training every day. The results then continue to improve over time and are maintained even if you stop training. That is obviously if you continue wearing your hearing aids, of course. The really cool thing about Lace AI Pro is that you can record your partner's voice or your children's voice, and the AI app will then adjust the voice for the training to be your partner's voice. It's a really fascinating function and makes the training that much better and more relatable. It trains all the relevant aspects. And what I'm going to do quickly is I'm going to bring this picture up. You can see here that it trains all relevant aspects. That is speech and noise, for example, which is obviously something most people struggle with. Equally as much difficult is rapid speech. And the training also includes like a missing word approach where it kind of fills in the blank. It contains speech reading and a working memory function as well. And as I mentioned earlier, all of these aspects are needed to successfully process speech, especially in the presence of background noise. So if you want to learn more about that, why don't you reach out to us? I've put a website also of Lace AI Pro in the description. And if you're a person with hearing loss, I strongly recommend using Lace. It's fantastic. And if you've had hearing aids for some time, even then it works really, really well. Now, if you are a hearing care provider that watches this video, I strongly recommend partnering with Lace as it makes the hearing outcomes for your patients so much better. Now, I wish you happy training and I'll see you in the next video. Until then, I wish you all the best and bye-bye.